Hello, I am Dr. Anaya, and today I will be explaining to you a clinical trial that I created, basically talking about the effect of interferons on cervical cancer and how it could potentially cure it in the near future. So my clinical trial is meant for females suffering from early stages of cervical cancer, stage 1 and 2, ranging from ages 25 to 44. 10 females suffering from early stages of cervical cancer will be selected as participants of this clinical trial. Potential risks include nausea, vomiting, trouble sleeping, fever, chills, flu-like symptoms, and more. And that is basically symptoms of the interferons entering your body. Potential benefits, however, include the slowing of the rapid increase of cancerous cells in the cervix, as well as the prevention of their spread. These cancerous cells will hopefully be degenerated after exposure of the interferon in question. The interferons will be administered to the patient through an intravenous drip, which is an IV, which will lead into the bloodstream. From there, the interferons will seep into the cervical wall, enter the cancer cells, and slow their ability to replicate by blocking or prolonging the cell cycle. While the cell cycle is being prolonged, the interferons have had they will have enough time to influence the cancer cells to produce more interferons. When the interferons are released from the cell, they alert the T cells, B cells, and NK cells to attack the cancerous cells. My central goal for this clinical trial is to allow the immune system to attack the cancer cells with the introduction of interferons by blocking or prolonging the cell cycle of the cancer cells, influencing the cancer cells to produce more interferons, alerting the T cells, B cells, NK cells, and others in the body to attack the cancer cells. A hypothesis I have come up with for this clinical trial is if interferons are administered to a patient in early stages of cervical cancer, then the immune system will begin attacking the cancer cells, getting rid of them and any future cancer cells to come. This will occur because the healthy cells and the cells of the immune system in the body will be able to recognize a deadly cancer cell the next time it appears in the body, and it will attack it. Some treatments that are being used right now to battle cervical cancer now include chemotherapy, radiation, and more. The problem with these treatments, however, are that they attack healthy cells in the body, as well as the cancer cells. This is not healthy for the patient, and it could become detrimental depending on their case. This clinical trial is meant to ensure that when patients with cervical cancer are being treated, their healthy cells aren't being degenerated as well. So my goal is to make this the healthiest treatment that could come out of cervical cancer, so that the patient is healthy as possible during this entire process. This clinical trial will be double-blind and randomized. This means that both the control and experimental group will be chosen at random. It also means that the scientists and patients involved will be oblivious to who is receiving the treatment. The Cervical Cancer on Interferons clinical trial is looking for 10 females suffering from early stages of cervical cancer ranging from ages 25 to 44. These females will be selected randomly. There will be a control group and an experimental group. The control group will receive a placebo drug instead of the interferon drip. The experimental group will receive the interferon drip. Who receives the interferon drip will be oblivious to the scientists that are working on the clinical trial, as well as the subjects, the patients. This will reduce any potential bias that could happen, and this will happen over a span of 9 months. Those eligible to participate in this clinical trial are women in early stages of cervical cancer, stage 1 and 2, ranging from ages 25 to 44, women who have not had the HPV vaccine, women who are sexually active, and women who do not have HPV. Those who are not eligible to participate in this clinical trial are women in later stages of cervical cancer, stage 3 and 4, women who do not fall in the range of ages between 25 and 44, women who have had the HPV vaccine, and women who are not sexually active. Women who also have HPV are not eligible to participate in this clinical trial. Assessment of safety, basically before this clinical trial, the medication and the process will be explained to the patients and their families. Each patient, both control and experimental, will be heavily monitored during their required inpatient hospitalization to ensure that they do not suffer any life-threatening symptoms from the interferon drip given. This is also to monitor their diet, exercise, symptoms, sleep patterns, and more. During the trials, we want to make sure that all patients have the same, or if not similar, diet, exercise, sleep patterns, and things like that. The patient's safety and health will be monitored by a multi-disciplinary team, including physicians, nurses, lab technicians, psychologists, and more. If for any reason a patient wishes to leave or quit the trial, they are absolutely within their rights to do so.